Everybody, welcome. I'm Daniel G. Garza, and this is a very special episode of Put It Together Conversations. There's really, we're hoping there'll be some conversations. Today is, as you saw in the intro, today is World AIDS Day, which is celebrated every year on December 1st. And let me get my camera set up over here. I am at Cobblestone Park in Laguna Beach. They set this over to public. There we go. We are at the Cobblestone Park here in Laguna Beach at the main beach. Welcome to the show. This is sponsored by the Laguna Beach HIV Advisory Committee, who are actually setting up behind me as we speak. The 3 o'clock hour was to, I hope you can hear me. If anybody's on there, can you let me know that you can hear me? This is today's is to honor those that have lived with HIV and those have passed from HIV. Thank you for your patience. I'm trying to coordinate, and I'm outside in the elements, which I'm usually not. So trying to make sure that everything looks good, sounds good. There we go. All right. I'm back. Hi. So I'm Daniel G. Garza, and this is World AIDS Day 2021. And I'm coming to you live from the Cobblestone Park here on Main Beach in Laguna Beach, California, to anywhere where you're watching. Today has been a very emotional day. My day actually started like at 6 o'clock this morning. I'm going to turn around so you guys can see what they're doing behind me. There we go. Am I crooked? They are setting up right behind me. There we go. They are setting up, and I'm kind of crooked because it's kind of crooked here, but they are setting up the tree right behind me there. That is the tree of names, and every year it gets bigger. Those are the names of the folks that have passed away from HIV or AIDS-related. Sorry, got there, choked up there for a second. Remember that you can join the conversation. Make sure that you, if you have any comments or any questions, that you ask them. Let me put that banner up. Make sure that we can put that up. Where is it? I don't have my ticker. There we go. It is going to be one of those afternoons. There we go. Join the conversation. I want you to be part of the conversation. I want you to make your comments if there's somebody that you want to remember today. So again, World AIDS Day, December 1st, 2021. It is celebrated every year. It's been celebrated every year since 1988. And every year it's more names. We do this every year. When I was the chair of the Laguna Beach HIV Advisory Committee, we also had some HIV Days of Awareness, but World AIDS Day is every year. I was saying that this morning started for me at 6 a.m. doing a panel in Florida, and it's been an all-day thing. Many of my colleagues have, hi Estela, many of my colleagues have been on panels, talked somewhere. There's tons of videos. There's, I hope I don't forget anybody, but Plus Magazine, AU Magazine, Pause Magazine, all different magazines have been launching their videos in remembrance of World AIDS Day. So make sure you check them out. If you follow me on Facebook, you will see some of those pages on there. You'll be able to check out some of the videos that I contributed to, some of the posts that I was part of. I'm very honored that this year Plus Magazine had me on their 25 Advocates to Notice People of the Year series. So that's pretty cool. I was one of the 25, which is pretty awesome. Well, yeah, we got to keep wearing awareness because the Latino community is usually the most impacted. I believe, this is my belief, that one of the reasons that we're mostly impacted is because of the language barriers, the cultural, the social norms, and the religious factors that stops us from opening up and speaking about HIV and AIDS. And we need to open up conversations. But more importantly, we need to teach people how to open up those conversations. Those conversations don't open up just on themselves. You don't just one day wake up and say, I'm going to talk about sex, sexuality, and diversity. We need to teach parents how to talk to their kids. And then we need to teach kids that it's okay to talk to their parents about HIV, AIDS, and sexuality. I was also on, yes, I was also on Univision Digital, Univision Digital, out of Florida. Were so kind enough to invite me on their show. It was a really quick blurb and a couple of questions, but I was honored. I think this is the second time that I'm on that show. I have to go back and look at my records, but I believe it's my second time. So I'll make sure to look at that. Yes, language and healthcare access, healthcare literacy barriers. Sí, siempre. There's always a barrier that stops us from speaking. And because I know from when I was a kid, going to my mom to the doctors because she didn't speak English and helping her translate. So I think I thought that would have made it easier for my parents to talk to me about sex and sexuality, but it was not. And somehow when I came out, it made it a little more difficult for them to express to me what sex and sexuality really was. I'm going to see if I can get some of the folks who are setting up in a minute. As you can see, they're still setting up the tree of names. It is it's foggy here in Laguna Beach. But also, I don't want this. It's supposed to be a meet and greet between 3 and 4, and then at 4 o'clock, the ceremony will start. The Candlelight Vigil will start. But this is also for you folks. If you have questions about HIV, if you are curious about my story on HIV and AIDS, and if I can answer or clarify anything, please don't get too technical because I don't have many on my notes here, and I don't remember everything all the time. The magic of television is that you can have notes right there with you. But this is an opportunity for you too. If you are not completely familiar with HIV and AIDS, and let me remind you, it is 40 years into the pandemic of HIV, and we still don't understand everything because it changes, it evolves, and people evolve. So I don't know all the answers, but I may have some answers. So if you have a question right now about HIV and AIDS, I'm going to turn around a little bit so you guys can see. I mean, we are in Laguna Beach, and I want you to experience all of the Laguna Beach. If you can hear the screams, that's because there's a volleyball team practicing right over there. I'm going to turn around this way for just a minute so you can see the hazy afternoon of Laguna Beach. Some of the folks are getting lined up, getting set up. Privacy and having these discussions on HIV or sex in an outside of your home is difficult for many because of our culture. Sí, siempre va a ser muy difícil. It's always going to be difficult to have a conversation, especially for Latinos. And I know a lot of other cultures too. I talk about Latinos because that's who I am. I'm going to turn around because I'm a little dark over there on that side. But for a lot of Latinos, a lot of cultures, it's really difficult to talk about sex and sexuality. We want children to wait till marriage to have sex. We want them to be protected and safe. But if we don't, okay, here's my thing. Religiously, we do want to wait till we're married to have sex. But I grew up in a time where gay men were not allowed to get married. So my head was like, if I'm supposed to wait till I get married to have sex, but as a gay man, I'm not allowed to get married. So when am I supposed to have sex? So you learn all these things from your friends. You learn these things from people at the bars. And I was very young when I started going to the bars and did not learn the proper way. So we were talking this morning. I was part of a panel, but there was a young lady who was 16, and she was talking to us about teaching in high schools and colleges, universities. And I asked her, do you believe, because we've been told as HIV educators that if we talk to students about sex, that somehow will put that idea in their head to go have sex. And she said, no. She was like, if you want to have sex, that thought will always be there. She knows people, she knows friends of hers who had sex in junior high and already had a baby by high school. So her suggestion was start talking to kids about sexuality as young as junior high, so that they are better prepared. A lot of them have already lost their virginity by the time they reach high school, and they're not mentally, spiritually, or physically prepared to do so. So we're not prepping them correctly. So I'm going to bring this to the table when I go to committees and groups to talk about sex, and make sure that we are having these discussions with kids younger. Because I've been informed, not just by her, but by other kids, talking about it does not make people want to talk about it. It's just like I used to hear conversations about drugs when I was young, and that wasn't what really pushed me to have to. That's not what pushed me to do drugs. Peer pressure from my first boyfriend, and not really his. I peer pressured myself. That's what got me to do drugs. So I think it's the same thing with sex. Now, spiritually, no, I don't think. Like, not to get too much into it, but I was molested very young, and I think I don't think. I know that spiritually affected me. The idea of not having control over your body and somebody else having control, not knowing what to do sexually. My spirits were low, and I was very insecure about myself, not just sexually, but in other ways. I was very insecure for years. So that was tough. Also, physically, as a young man, I wasn't prepared for sex. Um, I wasn't. Uh, Thank you for raising awareness. We need to start talking about safe sex, HIV, and AIDS. Having these discussions will help. And sí. El estigma, los secretos, el silencio, stigma, shame, and silence are the worst. That's what gets the kids. That's what gets young adults. And let me be frank, that's what gets older adults too. Like, if you are not prepared to talk about sex and sexuality, when was the last time, for anybody who's watching this, if you're dating, do you, not that maybe you don't, but do you talk to your partners about sex and testing, STDs? Are you having these conversations? Because most of the times we don't. I know I didn't, because I wasn't taught to do that. It wasn't part of my checklist. And you know what I'm talking about when you're dating and you're young. Like, is he cute? Is he a good kisser? Does he smell good? But nobody ever said that I needed to include, have you gotten an HIV test? Have you got an STD test? You know, is there anything I need to know sexually? And then starting to learn about my body, what happens to my body when I have sex, what happens to my body after sex. And I'm talking about like oral, anal, vaginal, like what happens to your body, because it changes, especially after the first time. And I mean, I know that there are people out there who talk about it, but did you get that chance with your family? Let me know in the comments. Did you, if you're watching this as an adult, did you have this conversation with your family, with your parents? Not with a family. I don't expect you to have a big old dinner with everybody sitting around talking about you losing your virginity. But did your parents talk to you about losing your virginity and what is expected to happen? Everything from the before, pre-sex, sex, and after sex. These are really important questions. There are more folks. There's some more gentlemen. We hope to have a nice little crowd tonight. I'm going to keep talking probably for another 45 minutes until people get here. I can tell you a little bit about my story. I've shared about it all day today. I was diagnosed in 2000. I was 29 years old, September of 2000. And this year was my 21st anniversary. And I celebrated because I survived. I lived. I was when my diagnosis came, there was the fear that I wouldn't make it, and yet I did. And at that moment, I decided that I was going to, um, I was going to have HIV. If it was going to be in my body, I was going to have it pay rent. I was going to make something useful out of my diagnosis and make it pay rent. And I started advocating. I started talking and public speaking, and I started to make a career out of it. And 21 years later, it's a career. So I'm very proud of that. I'm very proud of the fact that I've been able to talk to people all the way from South Texas to Houston, from San Diego to the California Valley. It's amazing the work that can be done when we put our minds to it. And I've had some great friends who were there were with me, people who wanted to be part of my journey and share in the story. Um, but I know dozens of advocates that have been in a similar situation, that they decided that HIV was not going to bring them down. Now, let me be honest. There are times when it does. There are days when my body is just like, I'm done with the meds. I'm over feeling sick sometimes. There are times when my body just wants to give up. And, well, you can't. You can't give up. You can't stop. Um, thank you, Piper. How are you doing, sweetie? This morning was one of those mornings where I felt very vulnerable. World AIDS Day. I've lost several friends over the years, and um, you have a little bit of a survivor's guilt. Like, why them and not me? Why did they pass and not me? Uh, Thank you. And this brings up a really good point. Thank you. I won't let you give up. Please don't. Um, Social support, a support system, everything from your family to friends to colleagues. Um, it's important to have a group of people there that are going to push you when it's needed, that are going to support you when you need it, but they're also going to let you break down and cry when you have to. And there are many days when I do break down and cry, and I enjoy those very much. I make a moment out of it. It's moment days when I break up are sad movies, tacos, and my pajamas on the couch. We need them. And today was one of those days after this morning session that I was presenting with the Department of Health from Charleston, South Carolina. We were virtually on a panel, and after that panel, it was early in the morning. It started at 6 for 2 hours, and by the time it was over, I was drained. Those first 2 hours of the morning just kind of drained me. Um, Yes, always tacos when you're drained, man. Tacos are life. Whenever, let me tell you, whenever I'm feeling sad, anybody who knows me knows that I'd go for the tacos. Um, Last year, I'm trying to think. I'm hoping, because last year we had people that were joined us who were not aware that we were having an event. So I'm hoping that they will join us today. I'm gonna have to plug my charger in a minute because my phone is draining pretty quick. Um, but let me turn my laptop around. There we go. Um, Checking for messages. Give me just a second. I am working on Wi-Fi's, and I need to get a better Wi-Fi. Does anybody know a good Wi-Fi system that I can get? Because I need a better one. Um, there we go. Oh, okay, somebody sent me some messages. All right. Um, if you have a question, if you have a comment, if there's anything you want to know, for those of you that are just joining, it is 20 after 3 here in Laguna Beach. And we are celebrating World AIDS Day. My name is Daniel G. Garza, and this is World AIDS Day brought to you by the Laguna Beach HIV Advisory Committee, and they should be making their appearance slowly. If you can see right behind me, right over there, there is the Tree of Names, Remembrance Tree. They are putting up the names of people who have passed from HIV and AIDS, and I don't know the exact number yet. I will when the chair gets here. We'll ask her about does she have an exact list of names uh, that she can give me? See how many people are on that list. Um, but what else can I tell you? What has happened over the years? Oh, here we go. We have a question. What was the most impactful story that you heard that made you tell yourself you're going to be okay? What was the most impactful story that you heard that made you tell yourself you were going to be okay? Early on, I was part of a support group, a very big support group, and there was a gentleman who had been diagnosed in the 80s. I was diagnosed in 2000. He was since the 80s, and he was a buddy. He wasn't doing well himself physically. Like you could tell he was tired. You could tell he was sick. But he still made it a point to go visit people and take them food and keep them company and go grocery shopping for them. And I thought, wow, here's this dude who is about to break himself, and he is more concerned about other people than himself. And I thought, if he can do it, if he can be of service and help, then I can too. And here's another friend of mine, James, over 30 years. Yeah, and he's been an advocate for many years. Another awesome story, James. One day I'll have to have him on my show here, live stream, and talk about it. But yeah, I'm 21 years. I know folks um, who have been on for have been positive forever, but they still find time to give. So I can't pinpoint one story. I've had the pleasure of an honor of meeting people who have been positive since the early 80s, and looking good. Thank you, babe. That's my baby brother. Yes, the fog it just adds an element. I'm gonna um, thank you, thank you. I look amazing. Well, we're using the phone today instead of the laptop. I'm gonna turn around so you guys can see the fog behind me. That is Laguna Beach. This December 1st. I'm gonna move back a little bit so you guys can see it. That is Laguna on this foggy afternoon. It is beautiful. There's a fog alert here today, but it is beautiful. It is beautiful today. I don't turn around this way because it makes me look darker. The light's coming from over there. So I'm gonna turn back around. It, it is super foggy. It is super foggy, and it's beautiful. It's just chilly enough for my denim jackets that I love. Question: what has been your motivating factor that have kept your advocacy and helping others so many years? The motivating factor is people helped me. When I was very sick, when I wasn't doing well, people were there for me. And okay, I'm gonna tell the story. And if I crack down and cry, this is on y'all. The when I was early diagnosed, I had to go to the hospital, and it was actually over Thanksgiving weekend. And I had been taken to the emergency room, and in this room there were 4 beds. I was in one. There was a guy like caddy corner from me, and there was a gentleman that was brought in by his mother, and very frail. I thought I was sick, and I mean I was skinny and frail, and I felt bad for him. So that night they brought us some soup. It was Thanksgiving weekend. It was Wednesday night, and they brought us some soup, and he couldn't eat. But I'd been in that hospital in that wing, so I knew that space. So I got up and went and warmed up his soup so he could eat it. And I helped him. He did a couple of spoonfuls of soup, and he didn't want anymore. And we went to sleep. I went to sleep. I was tired. Went to bed. And the next morning, I woke up to find out he had died overnight. And they were, because it was Thanksgiving weekend, they were not coming to get him fast enough. So he was laying there in the bed. But I never saw his family come to see him. And I felt so sad that this guy died alone. And he didn't speak English. And his mom didn't speak English when she left. And I called my sister that day because they were down in South Texas and I was in Houston. And I called crying, and I told her, please just don't leave me here. I was just afraid that I was going to die and I was going to be left there. I did not want to die alone. And has it caused abandonment issues? Oh, yes. I bring it up in therapy all the time. But the motivating factor that moves me to continue to do the work that I do in HIV advocacy is because I don't want another Latino person to die and not be able to communicate. And I fight for stigma and shame and the end of silence, because I don't want another person to be left alone in the hospital to die. And it scares me still. It scares me to today to die alone. I'm not afraid of dying. I've lived an amazing life, and I'm not afraid of when. Oh, there's my sister. I don't know if she remembers that day that I called her and I just said, please don't leave me here. Just don't leave me here. And it was because I saw that guy die. I mean, I saw him dead. And nobody should die alone. So I continue to speak up, and I continue to put myself out there. And I'm sure I've lost some jobs. Thank you. Y'all are making me cry now. Thank you. I've been asked before, like, since I'm an actor and a comic, have I ever lost jobs because of my advocacy or positive? I'm sure I have. I'm sure somebody's seen a video or read a blog or something and not hired me for a job. But I didn't even know you were going to be here watching this. That's my sister, folks. I'm sure I've lost jobs to being positive. I'm sure people have not hired me for things, but I have a need. I don't know, for those of you that do advocacy work, there's a need to speak up, to speak out, to share with people. And I'm not done yet. I'll be 51 in a month. Dang, where's the tacos? Who's gonna invite me to their my birthday tacos? I'm gonna see if I can get. There's still nobody here yet. Well, they're here, but they're busy. So I'm gonna wait to see who else shows up. Y'all made me cry. How dare you make me cry? Anyway, any more questions? Please feel free. The people that I'm supposed to interview are not here yet. So until they get here, It's just me, so they won't be here till like 4 o'clock. I will at one moment have to pull out my charger, so I'm gonna let you look at Laguna while I put my charger. If you guys think of a question to ask, um, I just saw somebody that I can interview, and I think he would be a perfect first guest. He is local to Laguna Beach. He's a singer, an artist. He does amazing work. Here I am. Um, as someone older, can I give you some advice? I'll put that up there in just a second. I'm plugging in my. There we go. As someone older, can I give you some advice? Always put the salsa first and then the lime juice. There you go. There's your. So much chillones, but at least we don't ugly cry. No, it's like I novela cry. Estela, Estela, no me dejes. We're gonna see if we can get some more folks over here, somebody to come over here to review. But do you have any questions? Do you have anything that I can answer? Is there anything that you may not know about HIV and AIDS that I can answer? Again, for everybody just watching, we're at 30 minutes in. I'm at the Cobblestone Park in Main Beach in Laguna Beach, California. Today is December 1st, 2021, World AIDS Day, and there are celebrations literally around the world. People celebrating. I've been up since 5 o'clock this morning doing different panels. One in Florida. If you were able to watch, I was on Univision Digital. Please share that you can't get HIV by hugging somebody. No, no, you cannot get HIV by hugging somebody. You cannot get HIV by eating after them on their fork, drinking after them, going to the bathroom, sharing bed, and even now, because of the U equals U campaign, which stands for undetectable equals untransmittable, which means that a person whose whose viral load is so low, that means that the virus can't be detected in a regular test, cannot infect somebody else. So that is something that has changed a lot since I was diagnosed. Then why would I listen to you, Virgin? Nope, you can't get it from kissing. You cannot get HIV by kissing somebody. The probabilities are very, very low. What would I tell somebody who just got diagnosed? Very good question. I get asked that quite a bit. If you are newly diagnosed with HIV, first of all, I want you to cry. Cry. Go cry. Get mad. I want you to go and completely break down. Give yourself permission to be mad. Give yourself permission to yell at God if you have to. Completely break down. That's the first thing I would tell you. You deserve to do that because it's about to change your life, and you need to completely let go of resentments and angers and hate and fear, because it's going to creep up on you anyway. Over the years, it'll creep up on you. But that I wish somebody had told me that first day when I was diagnosed, cry, get mad, yell, because it would have released a lot of that stress and anxiety and hate. And then what next? What next? Not everybody is meant to be an advocate. Not everybody's meant to be in for camera like I am. Not everybody's going to be an activist. Some people just want to live their lives. And that's the other thing. You will be able to live your life. Yes, there will be medications. There'll be extra doctor's visits. There'll be things that people without HIV might not have to do. But then again, I mean, I've had cancer. I have diabetes. Like, there's also these other things that even without HIV, I still have them. And I know people without HIV who still have to go to the doctor all the time and take medications for other stuff. So things are going to change. But I want you to know that the more important things in life like the bigger things in life, like dating, having children, getting married, not necessarily in that order, going back to school, finishing a career, getting a new job, buying a house, traveling around the world. None of that has to change. But but the first thing I would tell anybody is enojate, get mad. Yes, get mad, because yes, we are 40 years into the pandemic and we should know better. It's not that you did anything wrong and you're not bad and you're not a bad person, but get mad. And then once you let go of that energy, now we can move forward. But my next question is, what now? What do you want to do now? Trust me, it's actually harder to get HIV than many other viruses. You have to almost be determined. Yes, in this day and age, yes. And Christian said it right. Like, we've been together 9 years and he's negative. So there you go. There's the difference. But yeah, my first thing would be, if you're recently diagnosed, call me. Let's go get tacos and get mad together. I still have a lot of anger in me sometimes, folks. It's not always good. I'm going to see if we can get somebody out here to have a little chat. But while that comes, it's almost 30, it's 3:36 here. While we get set up, while we get somebody over here, I'll keep talking. The Candlelight Vigil starts at 4 o'clock. And at 4 o'clock, I'll be moving closer to the names. And so we got the names. We have the Candlelight Vigil, which last year, I believe there were 300 names, a little over 300 names. So there's that. So we'll find out in a minute. What advice would you give a parent of someone who has HIV? How can they support? I think, one thing that my mom did a little bit, once she realized a little bit about what HIV was, she just treated me normal. She just wouldn't let me get away with stuff. There was a point where the doctor said that I needed just to be more mobile because I was staying in bed too long. And she was like, you got to get up. If you want to eat, get up to the table. I'm not bringing you food to bed anymore. But I was very sick. I was like 108 pounds when I got diagnosed. So that was very sick. But if you are a parent, a brother, a sister, a family member of somebody who is HIV positive, what would I like to have been told? I don't know. And I think it was said to me. It was said to me, like, we love you. We still love you. And I don't want to cry again. Stop it, y'all. Love your kids. Love your family. Sorry, let me turn this. Love them. Love them. I mean, you don't just love them. Push them. Don't let them become a shell of who they were. Encourage them. Challenge them. But let them have their moment. Let them have their moment where they need to break down and just let go. So let them go. Comadre Kelly, ¿cómo estás? Saludos. I love you too. Thank you everybody for joining. It's about 3:40, and we are about 20 minutes to start for the Candlelight Vigil. Thank you. Well, ya sabes cómo soy. I tell people it's because I'm a ham for attention. I love getting attention. So if I need to start my own show to get my attention, I'm going to see if, Adriana, there's Adriana. I'm going to see Adriana is the chair of the Laguna Beach HIV committee, and I've been waiting for her to get here to start a conversation. Hopefully she can make it over here in just a second. I'm waving at her like she can see me. But Adriana is the chair. I was the former chair. She took my spot when I retired. We all need the moments of self-pity and regret. It's an important step to move forward. Yes, thanks, babe. Thanks for saying that. We need it because it's gonna happen again. It happens to me often that I get those moments of like, ay, mi vida. But if I hadn't had the practice of breaking down earlier on, I would not know how to get out of them now. So this is something important for kids too. Teach your kids to break down so that they can build themselves up again. Um, Let me see if I can get Adriana over here. Um, I'm gonna try and wave over at her and see if she'll make it over here. Um, I'm waving like I'm sad, like I'm close. We're gonna move closer in a minute. Trust me, we're gonna move closer in a minute. Um, Let me see if I can get her to notice me. Adriana, Adriana, can you get Adriana for me? Adriana, come over here. I've been waiting for you. There you go. We finally got her attention. I feel like I feel like you. You're the chair. Get over here. Here she is. I've been she she's an amazing friend. She's an amazing advocate. She's amazing at everything she does. How you doing?
Oh, I'm fine. Is it okay?
Yes, yes, please. Yes.
How
So
are you?
we are live.
Hello, everyone.
They've been with me for the last
Perfect.
40 minutes. So we're going to move over there in just a second. But
Okay.
for everybody, tell them who you are, what you do, and what's going on today.
Well, hello, everyone. My name is Adriana. Nieto Sai is a mouthful. I'm the clinic director at Laguna Beach, and I have the honor of being chair of the city's HIV advisory board. And I had big feet to fill. As you all know, he is our previous chair. And so it's hard to hold a candle to this wonderful man. As you all know, I am his biggest fan. But today we're gathered here, and thank you for doing this. We really, really appreciate it. This is how we can reach so many of you who are not here. I'm sure he talked about the beautiful beach, and there's a little fog rolling in. Is it Mrna layer? I can feel it. But then the sun's in your eyes. So it's a little bit of both. California weather, what can I say? But it's gorgeous. I think it's a perfect day. Today is World AIDS Day, and you know it's so important that we're here to continue to spread education, spread the word about what HIV patients go through, and more importantly, prevention. And in doing that, I'd like to share with you that we are currently giving HIV vouchers for free testing. That's a $40 voucher. And so we have some here. And also, if you want to ever come down, just say that you saw it here today live at Dan Garza's live stream for HIV World AIDS Day, and I will more than be happy to honor that request for the year 2022. Oh, I can't believe we're finishing this year. Ya se acabó. Entonces, muchísimo gusto y qué dicha tenerlos todos aquí juntos.
So I have some questions before we go on. COVID, the lockdown, as far as the HIV community, how did that affect the community?
I think that we learned a lot from what we had experienced during HIV. I think we learned about solidarity. We now got a glimpse to what a lot of people back in the 1980s and 1990s were going through when they had to isolate, when they were feeling stigmatized, because no one knew enough about HIV, and those that did were afraid to take care of patients. And thank goodness that those are the dark ages and we've moved forward. But the point of me saying this is that I think we learned a lot. I think we learned the most important thing, to be empathetic, to be caring, to pick up these great cellular phones and call people at home and say, hey, how are you doing? We're still here. The clinic did not close. And so we were open for all services, both telemedicine as well as patient face-to-face. But I think that's because we're very forward thinking, but I have to be due diligence that it all came from our experience taking care of HIV patients. back then. And I think that that really set the platform on how to handle, for at least for us, this COVID pandemic. Picking up the phone, checking basic necessities. Hey, I know you can't come out, but we're here. Do you need groceries? Do you, even before DoorDash was available, even a thought, we can just go to a local store and get groceries and bring them to your door. We can drop off thermometers if that's the case. But most importantly, people just wanted to talk.
Yep.
They just wanted to say, what's going on? What is the latest? Kind of reconfirming perhaps sometimes what the news was already saying it, but for more of a familiar face and someone that they can trust, like their providers, their case managers, their nurses, their doctors. And I think it was very important that we also, as a community, learned a little bit more about what the food pantry does here locally, what our great pharmacies do, delivering medications or needed items at home. And I have to say, the frontline grocery workers that were there to take our orders and pack them up and be there. So it really was a sense of community. And even the high school kids, they were so caring. I have to share this with you. They brought us a basket full of cookies and teas, but they are so artistic. They drew beautiful sceneries on them, and they said thank you. Just such powerful words for us as caregivers. In the midst of it, week after week, we were exhausted. A lot of us were actually doing COVID testing on site, so a lot of us unsure of how how contagious it was. We were afraid to bring it home. So a lot of us actually stayed in hotels just so we wouldn't bring it home to our families. There was a lot of sacrifice back then. But once again, we came together as a community and we learned. And I think, once again, the most important thing is the empathy, the caring that I hope was the platform from when we had the big crisis with epidemic with AIDS. And, nationwide, we're still losing a lot of patients. I mean, cases are at least 5,000 cases in California, and worldwide, it's over 1 million of deaths. So this is still very, very unfortunately live, and we still need to do everything we can to get people on PrEP, to get people to do HIV as part of a routine exam, to be able to talk about it, to be able to have conversations and all those wonderful podcasts that you do, and education. And it starts with the young. I think the young are wonderful. They are sponges. They are so versatile, and they're open. They're very non-judgmental. And I think the young generation teaches us how to be and how we should behave. So
There's one question before you go. There's one question that they asked me, and I wanted to get your perspective. They asked me, what would I say to somebody who is newly diagnosed in this day, 40 years later? What would you, or what do you say to somebody who's newly diagnosed?
I will confirm again, this is not a death sentence. I think it's very powerful to hear those words. Yes, you have HIV, but the good news is, if you get into treatment as soon as possible, if you adhere to it, keep your appointments, find a doctor that's close to you, that you have a good report with, that answers your question, makes you feel comfortable, stay on that medical regimen, and then things just happen. And we will be talking about this until you're a grandpa or a grandma. So I think it's very important to validate the disease, validate that it's no longer a death sentence, and also know there are a lot of medications now out there that if you stay on them, you will live a very healthy and fruitful life.
Awesome. Thank you so much.
Thank you.
We're
for
gonna
having
be.
us. Thank you, guys. We'll be seeing you when we're going to do the
We're gonna-
Candlelight
I
Vigil.
hope
and
my
more
people.
come in.
Yeah, we'll remember there. Thank you so much. And before you go, tell them where they are and tell them again about the.
Okay, once again, these are free HIV vouchers, and they provide a free $40 test at the clinic. So if anybody would like to have some, it'd be terrific. We'll keep them here for you. If you say you saw it here on Dan Garza's live stream for today, I will more than happily honor that for the next year. So that's the expiration until World AIDS next year.
Thank you so much, sweetheart.
Thank you.
I love you so
sweetheart.
much.
Love you. Thank you so much for doing this.
We'll
I
see you over there in a
appreciate it.
second.
Absolutely. Take
Thank
care,
you.
everybody. Be safe.
What else can you ask for? Like, if no matter where you are, um, yes, I will show her your thank you, of course, babe. For those of you like, you want to get tested and you're not sure, come to Laguna Beach. Come and see the beaches. Come and have some tacos with me and go get tested. I will be right there with you. And it's free. She's going to do that. How cool is she going to do that for us? So it's about 10 minutes till. And we don't have a lot of people. So I have a whole table that I need to move. So I might have to find some hands to help me move this over in just a second. So yes, she's awesome, and I just love her. She always says that I'm her mentor, which is crazy. Uh, but yes, it is pretty awesome. It's pretty awesome, especially for anybody who lives out here in this area. She took over my seat as the chair when I retired as the chair of the Laguna Beach Advisory Committee. But then that's another reason why I do this, because this was my space, and I live here. I practically live right there that way, like 5 minutes walking. So if you're ever out here, come and let me know. I'm going to see if I can find some people to help me move the table over in just a second. Let me see if we can get somebody to help me move. Um, I don't have a lot of stuff out here, but I do have some stuff out here. I'm going to keep talking while I put some stuff in my tote bag uh, so that we can move my table over. Um, I am very professional today, by the way, if I may add. Um, we'll see if somebody is able and capable of helping me move. Um, give me just a second. I didn't think about this part when I set up, now did I? Oh, thank you, thank you. I try. I know I've learned a lot in my. Oh, by the way, today is December 1st. Today Today, I celebrate 16 years in the entertainment business. 16 years ago today, on World AIDS Day, I did my first hosting gig at Houston Media Source in Houston, Texas. George Iniguez was my producer, and he taught me. He got me into show business. He got me into entertainment. So I've been doing this 16 years today. So not only do I celebrate World AIDS Day, but I celebrate my 16 years career in entertainment. Thank you. Yes, yes. So I hope I've learned a couple of things in 16 years. You've spelled that wrong. 5 minutes really good. And Nancy, my sister Nancy, she loves coming out here to Laguna Beach, and she always gets lost on the way home. I never put the D in the right place. I'm not going to go there. I was going to go there, but I'm not going to go there. Let me see if I can get some hands to help me move. Um, it's not a heavy bag table, but let me wave somebody over. Um, so that way I can get another interview in before 4 o'clock. But give me just a second. La 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 la. I'll keep talking. It is getting foggier and colder because the sun's going down. Um, let me. I'm gonna let y'all look at the beach for a second. Don't go anywhere. Thank you, thank you. So don't go anywhere. I'm gonna go move some stuff. So I'm gonna let you look over at the the water for a little bit. So you guys stay there. Don't go anywhere. I'll be back in a couple of seconds. If you don't mind taking this, and it's on right now, so people can hear you. You want to comment as you walk around?
I don't want just show
Here.
my face.
Okay. Yeah. If you want
Yes,
to, you want
there
to
you
talk
go.
to people.
See, everybody,
Here's
this is all my wonderful
There's the camera
helpers.
right here.
Oh,
It's
you
on.
want me to
Yeah,
go
you
on the
can talk to
camera?
them as
Okay.
you go.
As you can
Do you mind
see,
grabbing
this
it from
is,
that end over
be
there?
careful, and over there at the end. There you go.
Do you mind?
Yeah, that'd be great. Thank you. This is only possible because of all these wonderful helpers. This is Bob Lively and this is Diana. They're both on our city's HIV advisory committee. And as you can see, many hands make less work. Yes. And we're on the cobblestone, so we do need to be careful of little holes. And as you can see, there are more of the committee members coming. And then that's a beautiful marine layer. And that is all the Mrna layer going in. And then there is Dan walking really hard and setting everything up. Oh, hi, handsome. It's so wonderful to see everybody.
Yes. How you doing? Good to see you.
Oh, very nice.
I'm that guy. You know, it's one of those things. Like, I got myself all set up, not realizing that I had to move at some point. But I'm gonna turn around. And here I am. I know we're crooked a little bit, but when have I been straight? There you. As long as you're here, it's good. No, you're not going to talk to me. How dare you, sir? Yes, it's the Pacific Coast Highway, and let me lower this down a little bit. All right, I'm gonna try and get somebody else to talk to me before we start. We have a couple of minutes before we start um, talking before we start with the names. But here we are again, a different view, still me. Hello. For those of you that are just joining, we're about approaching the second hour of the Laguna Beach HIV Advisory Committee World AIDS Day event. We've already done the meet and greet. We met Adriana. Now we're going to read the names shortly. So maybe we can get Dr. Jorgensen was actually my first doctor when I moved to Laguna Beach, and maybe he can come over and chat a little bit and tell us about his history as a doctor. And sorry, I'm just turning my laptop around so I can see. Um, there we go. Let's see if we can get somebody else to come over and chat. Um, we'll get somebody over here in just a second. Any more questions? Anybody have anything else you want to add? Again, this is World AIDS Day, December 1st, 2021. We are at Cobblestone Beach, main beach in Laguna Beach. And this is my 21st World AIDS Day. I was diagnosed in September of 2000, so this will be my 21st. Let me see who else I can wrangle over here before we start. You can't see this, but let me turn this over around just a little bit. Sorry, my microphone got tangled before it fell. I know you're probably like going, what the hell is going with the camera? There you go. Whoa. There we go. You see some of the folks over here. I'm going to see if I can get Dr. Jorgensen. Doctor, how can a newly diagnosed person find services in the local area? Are there any easy resources? Yes. Most of the times, if you Google HIV services, you will find an agency near you. Even if they don't have AIDS or HIV in their name, they're always linked somehow so that the name will appear. So if you're looking for services in HIV, always Google HIV services and an agency should pop up. Thank you so much for spreading more awareness and being such an amazing human. And honored to call you friend. Oh, thank you. I'm, again, I do this because I have a need to talk. I do this because I'm a ham for attention, and I do this because I don't want people to go through what I went through. Although I know that that's unrealistic, because people will go through their own journeys and adventures. But whatever I can do to help in the situation, I will help. I just tangled my microphone. There we go. If y'all saw the mess that's down here, it's always what you don't see, right? That behind the scenes stuff. Hold on a second. I got tangled. There we go. Let me see if I can get one more person to come and talk before we start. I'll see if Dr. Jorgensen. Dr. Jorgensen is the one right there in blue. Dr. Jorgensen, can I bug you for a minute? You're always such a great interview.
My favorite
How are you?
interviewer.
For those of you, my first doctor when I moved to Laguna Beach was Dr. Jorgensen. And how long, well, first of all, tell them who you are and how long you've been a doctor.
Hey,
All the
good.
stuff.
A little bit of self-promotion here.
Yes.
I'm Corey Jorgensen. I'm an MD. I had the privilege of working at the Laguna Beach Community Clinic and running the HIV treatment program there. And Daniel was one of my star patients.
Oh, thank you.
So,
Well, I have to. You gave me hard times when I wasn't doing the right things. So, in order for me to not get in trouble when I went to go see him, I started doing the right thing and eating right, taking my meds, doing what I needed to do. Over the many years that you were in service and up to now, I've asked you this question before, but what has been some of the major steps forwards that you've seen?
well, probably the first really important step was getting an HIV test. When we started, we didn't have a test. The second one was getting some better lab work. We were able to get viral load testing in the late 90s, as well as multi-drug therapy, that is 3-drug therapy. Those were the two developments that made it much easier and safer to treat HIV. I think the fourth thing to come along is better acceptance and knowledge by the public at large. And the fifth thing is medicines that are now safer and easier to take. No one today needs to die of AIDS in this country for lack of medication, because they are available and they will be paid for by the Ryan White program. Yes, it still exists. Yeah. So everyone can get medication for their HIV. And as a result, it has become a treatable illness that people will live out their years with.
That's excellent.
No cure yet. No cure yet, but we're hoping.
Speaking of what was the impact of PrEP and U equals U in the HIV community?
I think it was a great shorthand for letting doctors as well as consumers know that if they are undetectable, they can really liberalize their contact with their chosen partner. Because when you're undetectable, you don't transmit. Undetectable means
Untransmittable.
Untransmittable. Thank you very much. And so I think that was a great PR campaign, if you want to call it. And what was the other one?
PrEP.
Oh, PrEP. Yeah, well, PrEP, pre-exposure prophylaxis, really allowed men at risk, gay men mostly, but also women who maybe had their husband was HIV positive, allows them to take medication and not worry about giving their infection, getting their infection from their partner. So the wife or the boyfriend can take this medicine and not worry about getting HIV.
We have a question here for you. What do you think are the possibility of an mRNA vaccine for HIV?
Wow, I would love that. I hope that it happens. I don't know enough about it, but it certainly worked for the pandemic that we're dealing with now, and that is this COVID virus. Another one that I kind of think I might live to see is a cure. I mean, we didn't think hepatitis C was curable. It's curable now. You take medicine for a month, and over 99% of people get cured of Hep C. So I love that.
And we have one more question for you. How do you have HIV that is undetectable, but still have it?
Yeah, that's a great question that is tough to get around sometimes. HIV positive means that you have antibodies to the virus, the AIDS virus. Undetectable means they can't find any living viral particles in your blood. And that means you're taking medicine and it's suppressing the virus. So the HIV positive is simply an antibody test. And similarly, let's say you had measles. You got antibodies against measles, but you're over the measles. You still have the antibodies. You still have no measles because you're cured. You got over it, but you'll always have that positive antibody test. And that's how it is with HIV too. You always have a positive test, and maybe you don't transmit because your HIV titer is so low, but that's why you can't find any living viruses.
So the follow-up is they are more of a dormant style virus.
Well, yes, you could think of that. Yeah, I think that's
simple terms.
I think that's an okay way to put it. I'll tell you where they're incubating and hiding out is in your DNA.
Oh.
Yeah, so in your cells, and that's been the challenge of getting a cure. We need to flush those germs out and then kill them, and we don't know how to do that yet.
My partner Christian is saying hi. You're such a pillar of positivity.
Oh, great!
And my last question, because we've asked this a couple of times. 40 years later, somebody getting diagnosed, what would you tell to that person who's newly diagnosed?
What I tell people and have told people is what I would tell the next one, and that is with proper medical care, there is no reason you can't have a normal life, a normal sex life, and in fact, you can have kids these days too. If everybody is taking their medication, and you can get an HIV negative baby. So it has totally allowed people to go back to resume a normal life.
That's awesome. Thank you so much for stopping to talk. Love you so much.
I love you too. And thank you for getting the word out.
My pleasure always. My pleasure. Thank you. Dr. Jorgensen. Yes, he's always happy to answer the questions. You can't flush DNA just yet because I would change my DNA to 6 feet tall. Yeah, you and me both. I would add a couple of inches. Stop it. We're getting more people that are coming. It is already past 4 o'clock. For those of you that are joining, I'm Daniel G. Garza. This is a special episode. It's December 1st, World AIDS Day. And you're welcome. I'm glad you're learning. I'm glad. Saludos, Jose. ¿Cómo estás? That's what he said. Just a couple. I'm not greedy. You know what? But it's World AIDS Day. It's December 1st, 2012. It's World AIDS Day. And did my laptop just die? I think my laptop just died. Yep, I think so. But yes, it did, because I don't have a guest on there anymore. So I'm going to close up my laptop because it's dead. I need another battery for my laptop. That's what's going to happen. If you can see behind me, that's the tree of names. And December 1st, 2012, World AIDS Day. So happy to be here. Thank you for joining me for this last hour. So 5-2. Funny. You're funny, sir. I don't know where we are. I have to cut off at 5. I'm going to another event. So I'm hoping that we get the names here soon. That lady behind me, where is she? Let me turn around so you guys can see some of the faces. And I cover them. As you can see, that's Adriana, Sandy St. John. She is a pillar of Laguna Beach. She is the mover and shaker. She's the one that hires me for all the events that I do. If you watch the Veterans Day Veterans Day show. That was me too. She got me to it. Oh, you're welcome. Thank you. Thank you for watching. I'm always excited. I'm glad to be part of this. I'm always excited when I can show some information, share some information, show Laguna Beach. Um, we got a lady with a puppy. I don't know what's going on, but the Java dogs. You should call her over for a moment. I should. Call her over. And she doesn't really do interviews, but I'm going to try and see if she does it. So hold on a second. There's a couple of things that I need to do. Let me see if I can get her over here. She usually gets me in front of the camera, but doesn't get on the camera herself. But I'm going to try to get her over here. Sandy, would you come over? No, you're good. You're good. Hi, Sandy.
Hi, Daniel.
How are you?
Happy World AIDS Day.
Happy World AIDS Day to
Thank you
you.
for being here.
My pleasure.
This is very exciting and very heartwarming to be here and have these wonderful people coming.
Now, I always brag to everybody about what a mover and shaker you are in Laguna
Oh,
Beach.
stop it, please. This is World AIDS Day. That's what we'll talk about. I love
Sandy
you.
says jump, and before she says I'm jumping. But how long have you been involved in the World AIDS Day events?
Probably 30 years.
30 years?
Probably. I've been one of the, 90, 89, somewhere in there. Yeah. I've been on the
And
committee that long.
other than the adding names to the list, what are some of the changes that you've seen throughout the years?
Well, the good changes are how this has gone down every year, every month, right? And how more and more as the years go on, people are more accepted to this. And we're getting the education out because we do flyers, we do brochures, we speak at events. We are now going to schools and speaking. And it's just amazing how many people are afraid of the AIDS and know nothing about it. And all we're trying to let them know is get tested. If you have it, your lifespan is the same as anybody who doesn't have HIV or AIDS if you get on medication. So it's not a disease that kills anybody anymore, and there shouldn't.
And thinking back to those early years, what was the shame and stigma like in the community?
Well, I think people were just afraid. They were afraid of it. So people didn't talk about it. People didn't want to know about it. And I think it's still going on today. Earlier, we had some guy here who knew nothing and he couldn't understand why we'd be doing anything so stupid. So, and there was no talking to him. So that was kind of the end of it. So it's about education. And that's basically what we do and try to do. Educate people about, what it is, how it can be cured. The clinic is here today giving out vouchers to come and get a free test. It could even be a test where you could make up a name. They don't really care, and come back and get the results. And then it's up to you what you do with it. But I love the fact that you can go in there and not even use your name if you don't want. You can be Tom Jones or Mickey Mouse or whatever. They don't care. That's the way it works. And then you get the results back, and they can help you if you let them help, if you let them.
Now, one question that I've always had for you is, why do you continue to do all that you do for the community?
Because I think that's why we were put on this earth, to give back, right? I'm grateful for whatever I have, and I just want to give back whatever I can, try to put a little bit of love out there and help people. I think that's why God created us, to help people, to help our brothers, to help everybody, whether it's the homeless or, someone that needs whatever they need, a phone number or help doing something or taking them somewhere. So that's basically why we're all here. We're here to help people, right? But we're here to help people.
And let me tell you, this lady has a beautiful soul, has always pushed me, encouraged me, challenged me to be better. And that's why anytime she calls me, I'm like, whatever you need, I'm there.
You are better. That's why I call you all the time. I call
Love you
all the time because you do everything.
Thank you.
I love you.
Thank you so much, Sandy. Love her. Yeah, Sandy is the coolest. Yeah, thank you, Sandy. She is awesome. Yep. We have come a long way. Yes, thank you. And education is the key. So I am not sure where we are with the names right now. Um, Obviously, there's another conversation going on behind me. Uh, but if you don't have a Sandy St. John, and that's her real name, Sandy St. John, you don't have a Sandy St. John in your life, get one. She has, ever since she's met me, she has pushed me and just encouraged me to do stuff. And she's one of those people when I say, if you think I can, I know I can. She is one of those people. When she says, I think you can do this, I know I can because she has seen me grow over the last 12 years. And part of who I am as a presenter and host is in thanks to her for pushing me to do what I do. So I guess that's another thing. Like HIV has not stopped me. Obviously, it doesn't stop me from talking. So it's I don't know. I like a good challenge, and challenging people's thoughts about HIV is like I will do that. I will do that. Um, C&D can be postponed to World AIDS Day. Oh well, yeah. Well, we for those of you who are fans of and follow us on the Kristen and Daniel show, we will not have a Kristen and Daniel show tonight. I'm running from here. I need to go to another event, so I have another event coming up at 6 o'clock. So we will not be having Kristen and Daniel show. We will have a show next week. So yes, so for those of you, we'll see you next week on the Kristen and Daniel show. I don't know where the names are. Uh, so what's happening?
We're waiting for BJ.
Okay.
He should be arriving. He's our MC
Right.
of the Candlelight Vigil. And so I'm just waiting for him to arrive so we can start our Candlelight Vigil.
It's like waiting for Santa Claus to get here
Yeah.
with the names.
I'm surprised because normally he's arrived by now, but I'm going to give him a few more minutes. And I know he's coming from up the hill, so it looks like it's very foggy up there.
Oh yeah.
So
Do you know
It's
offhand
odd.
how many names are on the list this year?
I do. We actually have 250 names
250.
to get through. I do.
Okay. So
I
for
know
those
the
of you,
number, yes.
we have 250 names this year on the list. Oh, I love you too, Calvin. No, thank you. Little happy face there.
Okay, so BJ just called, and he is running late. Unfortunately, he had a death to deal with.
Oh dear.
But it's perfect. He just wants to apologize, but he will be here. No worries.
Okay.
No worries.
So we are delayed a little in the reading of the names, and then I might stay a little longer than I expected. But as long as you guys stick around, we will be here. We'll be here again. If you have any questions regarding HIV/AIDS, World AIDS Day, don't get too technical because I don't have any on my notes with me today. But
God bless him. He is on his way. I knew something was odd since he wasn't. God bless him. Things happen, so
Yeah.
you know.
and it's really first of all, it's really foggy out here today, and second, he's a pastor. Sure, he's a pastor, so he had
he's busy.
pastoral needs
He's
today.
way up there. You can't even see the homes
No,
anymore.
no. If you, in case, let me take you guys.
I don't know
That
why
is-
everybody knew.
That is the top of the hill, which you can see nothing. I guess while we find, well, when the names get here, we have about 10 more minutes for the names reading. Maybe we can find somebody else to come and chat or share. Yes, please send them over. We have a couple of people who are visiting that would, yeah, come on over. How are you doing?
Good. How are you?
Good. I'm Daniel.
Hi. Nice to meet you, Daniel. Robert.
Introduce yourself because I don't know you either. So,
Hi, everyone. My name is Robert. I'm actually Adriana's son.
oh, that's right. We did
yeah.
meet.
Yeah, we did. We met.
We met a
couple
year
times.
ago.
Yes, we did. Yes, we did.
I met him a year ago in the last, no, 2 years ago. The last.
About 2 years ago.
That's what. Other than, I mean, obviously, World AIDS Day, your mom,
Yes.
but personally, what brings you out here today?
Well, actually, I studied public health and at the University of Hawaii at Manoa. And one of the things that I worked on, especially during my final years, was that I decided to do obesity just because that really affected the Latino community. But I also did some research on HIV as well, specifically in the Hawaiian states, the Hawaiian Islands. But I did some research with HIV there. And, I kind of got inspired to come here and try to do some work here in my own community. And then that's why I decided to join the HIV board. And,
That's really interesting, and because one of the conversations that we have, and scoot over this way so people can see you, stigma, shame, and silence.
yes.
What can you tell us about the Hawaiian culture?
Well, the Hawaiian culture is actually quite an open culture. Even within the culture itself, Hawaiians, they actually had three different, I believe the right word is genders. They had males and females, but then they also had this other gender where it was actually a mix of both.
Right.
So there was already this openness of just being yourself and being, if you were, biologically born male, but you had more female attributes or so on and so forth, you can be that way. There was nothing wrong with it. So it was embraced. So in terms of stigma, at least in Hawaii, there wasn't really that much of a stigma because the Hawaiian culture is already very open to that, and they're very welcoming. And that was something that I really loved about the Hawaiian culture, and that was something that I learned right away. Now, in terms of pop culture and everything today, of course, there's that stigma, and then the 80s epidemic that happened and all those deaths. And I guess that stigma against people who are gay, I mean, that obviously didn't help. And that obviously is something that still persists to this day. But in terms of the research that I did in Hawaii, there wasn't that much of a stigma as it is here, or at least in the mainland here.
Yeah, because one of the things that I talk about a lot in my advocacy work with Latinos is how our religious, cultural, and social norms keep us from talking about sex and sexuality.
Yes.
Did you find any of that in the Hawaiian culture?
In the Hawaiian culture, no, because in Hawaiian culture, the religion as well is not necessarily as, I guess, closed-minded as maybe, or very set in its ways as maybe being Latino, being Catholic or Christian is. For Catholics, it was at the beginning, it was Adam and Eve, and it's Adam and Eve, and that's it. There's no two Adams, there's no something else, there's no two Eves, it's nothing like that. While in the Hawaiian culture, you have almost like a Greek mythology where you have different gods and different beings. They all have different responsibilities. But, in terms of when they talk about sexuality, both males and females, come together. But then there's also two males that come together. There's also two females that come together. So the story, the sexuality, I guess, within mostly Hawaiian culture, it's very more open and more, I guess, welcoming for both.
Yeah, the comment here is that the missionaries are the ones that
yes, that's exactly.
culture.
Thank you. That's a great point. Yeah, the missionaries really made it more secularized and made it more, well,
got it.
more.
So-
it's this way. This way.
You're a young guy.
Yeah.
What is, among your peers,
Yeah.
the current thoughts about HIV and AIDS?
Right now, I think that we are a lot more of an open generation, and we see it. We don't see it as a stigma or anything like that. So I feel like right now we're a lot more open and understanding and learning more about HIV, and of course really being hands-on with HIV prevention, safe sex, condom usage, so on and so forth. PrEP, of course, if you have a partner that
I'm so
has
glad that
HIV.
you're so well informed.
Yeah. And in terms of that, I think that we are a generation that is maybe less ignorant, and we've lived and we've learned through our history, especially the 80s and 90s, and losing a lot of culturally iconic people to HIV.
Right.
I think we really we've become a lot more open to it and trying to educate ourselves on it.
So growing up with the mom who was in the healthcare,
Yeah.
were you made aware of a lot of things early on?
For the most part, yes. I didn't necessarily understand it at the time because I was kind of ignorant as a little kid, of course. But once I started getting into middle school, I even went to school here in Laguna Beach. Then I started getting aware of what HIV was, what all these other diseases were, so on and so forth. And I really started seeing the significance of it and how it affected individuals, and not just the individuals, but the families of those individuals as well. And then the whole religious aspect, the whole cultural aspect, all this other stuff. So
That's pretty cool. Well, I so appreciate you. So, any message you want to send out to anybody out there who's feeling stigmatized or feeling shame about HIV? Anything you could tell them?
That there is really no need to feel shamed. I understand if maybe you're necessarily in a family that maybe has that stigma, or have a couple friends who have shared that with you, or have said some negative things to your face or even behind your back. But I think the first things first is that you need to, first of all, try to find, whether it be a friend, a closer friend, or something that is someone who's understands, is not ignorant to HIV, and someone that is empathetic, and try to stay with that person or that group of people. And then really just make sure you're honest, especially if you do meet somebody, and about your HIV diagnosis, if you are HIV positive, and just try to realize, it's, that you can now live a normal life, thank God, through all the research that's been done and all the medical work that's been done. So that's, I guess, what I would personally say.
Thank you so much. So good to see you again.
Yeah,
I forgot.
No,
It's always like
yeah, it's the mask.
right, like, but we met a couple of years ago when we were putting up the ribbons around town and stuff.
Yes, sir. Yes,
So,
sir.
but if I don't get to see you again, Happy New Year.
No, Happy New Year too.
We'll see you again.
Yeah, see you
Thank you,
again.
sir.
Thank you. Thank you.
Pastor is here. That is him right there. So I'm going to start getting situated for the reading of the names. Let me move the camera over. Hi. Good. Do you have a minute before we start? How are you doing?
Good. How are you?
Good. Come on
Good to
over.
see you.
We're still streaming live.
All right.
Tell the folks who you are and what you do here in Laguna.
I'm Terrell Washington Nancy, and I'm a Laguna Beach artist and a performer.
So if you folks saw the World AIDS Day last year,
and
where
the
you,
year before that.
yes, where you sang Hallelujah.
Right.
So this was him. I know you couldn't see him because it was really dark that night, and my camera was all bad.
Right.
Yeah. So, but that was him singing in the background. So just in
I
case.
look better.
How are you doing?
I'm doing great. How
You
about
look
you?
great.
Thank you.
It's
Thank
been a
you.
while since I saw you.
I know. I
Uh,
saw you over there. Look at him go.
You know, that's what I do. Talk.
I know.
I talk.
You talk and you do well.
What's new in your life?
Talk a lot. It's like doing a lot of talking, a lot of performing, and writing. I'm finishing up a book.
Nice.
Yeah. So I'm having fun with that.
We've been scheduling an interview with him for like 10 years. And
It's gonna happen.
It's never happened. But maybe now that the book is coming out.
That's what I was
Maybe now
thinking.
that the book's coming out. Let me
Right.
make sure the folks can see you.
Okay.
We're almost going to start over there, but a special World Day message for the folks watching.
Remember to love everyone, love and respect whoever they are and what they are. We lost a lot of people with the AIDS epidemic, and I was really a part of that, and it was hard to see people go that I figured didn't need to really go. Our society has to be better, and now we have the pandemic, so I guess it is what it is. It just comes a time that we lose our people, but we should be more loving and more caring of those people.
Thank you so much. So good to see you.
Good to see you.
All right, I think we're going to go get set up. I'm going to need some help from some people in a minute, but to move the table over closer.
What do you need?
Yeah, we're going to move again, folks.
Like, what do you need?
Can you grab that end over there for me?
Let me get that here for now. Okay. All right. Are you gonna be singing? Yes, I am. After I finish doing this.
All right, that's good. I like that.
We're going to turn.
So, welcome to our World AIDS Day celebration. If you can call it a celebration. Celebration of the continued fight for justice, for love, for compassion, for pure, or just humanity to come together and be the best that it can be.
I've had the privilege of doing this now for 14 years,
Forever.
for a long time, and it seems like every year the weather is perfect. I mean, today it's fog,
Yeah.
and COVID has been one big fog, and I think all of the stuff that makes our lives valuable feels like we're just sucked in fog. And so it's wonderful on a day like today to just sit and be in the presence of a history and a mission to care and to eradicate a terrible disease, and to realize we can focus our lives on what is positive, on what brings us together, on what brings light. And it's lovely to have the light here with us. So just take a second, look around, and say, what in my life is giving me fog, and what do I give permission fog to go away? So just take a second and let's just kind of settle into that. If you'll permit me a brief prayer. Gracious and loving God, Spirit of life, source of truth, be with us this day. Enlighten our minds to perceive, pass forward. Broaden our hearts that we can embrace those who have died with such love and fervor that our hearts may expand to overflowing. Be with our society that we may remain focused on going to those who need help, those who have been thought to be less than in any way. Help us to be a cause of justice and peace and hope and joy in the midst of a season of fog and despair. Help us to see the light of this season and to embrace it for ourselves and for those we love. Amen. Do we want to read the names
Yes,
and
we're
then
gonna
sing?
start.
Okay. So I normally have these lovely chimes, and I forgot them at home. So I'm going to do this with my phone. It will probably be pathetic, but it's the spirit that matters.
We're ready to start whenever.
Augusta E.
Elliot S.
Joe T.
Peter J.
Can you maybe be a little bit louder?
I've got it all the way up. I'm really sorry.
Can we use the microphone maybe to?
Do we have an amplifier?
This is just called
But we can do this.
Thank Diane.
Peter R.
Tom H.
Albert Z.
Elisel H.
John D.
Peter M.
Tom K.
Alexander B.
Eloy G.
John C.
Philip D.
Tom P.
Almaz A.
Eric O.
John H.
R.P.
Tom Q.
Andrew C.
Eric P.
John M.
Ralph K.
Tom W.
Anthony P.
Eric W.
John P.
Ralph M.
Victor A. Arnold C.
Eugene C.
John S.
Randall C.
Victor B. Art G.
Federico R.
John T.
Randy.
Victor O. Bianca M.
Fleming B.
John U.
Ray N. F.
Vince C. Bill C.
Floyd F.
Joseph B.
Ray N.
Walter H. Bill M.
Frank N.
Joe L.
Raymond C.
Walter P. Bob H.
Frank R.
Joseph M.
Raymond D.
Wayne P. Brent C.
Fred W.
Juan L.
Richard E.
Wayne Scott B. Brent E.
Gary B.
Julius O.
Richard L.
Wesley B. Brian A.
Gary D.
Keith S.
Richard Y.
William A. Brian E.
Gary E.
Ken S.
Rick D.
William H. Brian M.
Gary P.
Kent H.
Ricky W.
William N. Bruce J.
Gary Y.
Kevin K.
Robert B.
William S. Bruce W.
George F.
Larry B.
Robert C.
William T. Buddy S.
George P.
Larry F.
Robert D.
Hunter A. Calvin J.
Gerard F.
Lee D.
Robert G.
Howie B. Candy R.
Gordon W.
Lee H.
Robert R.
Charles M.
Graham H.
Lee U.
Robert S.
Charles O.
Greg B.
Louis R.
Robert U.
Christopher K.
Greg C.
Lauren E.
Robert B.
Christopher M.
Greg D.
Mark P.
Roger R.
Chuck P.
Gregory M.
Mark L.
Roger O.
Clifford R.
Ian F.
Mark G.
Roland N.
Courtney J.
Ignacio G.
Mark L.
Ron B.
Dana E.
Jamel D.
Mark M.
Ron E.
Darren K.
James F.
Mark T.
Ron E.
David G.
James H.
Martin L.
Ronald C.
David N.
James S.
Matthew T.
Ronald L.
David T.
Jan N.
Michael C.
Russell E.
Dean S.
J S.
Michael D.
Sam F.
Denise L.
Jeanette T.
Michael F.
Scott C.
Dennis C.
Jeff Q.
Michael G.
Sergio N.
Dennis L.
Jeffrey B.
Michael J.
Shirley W.
Dolores E.
Jeremy M.
Michael O.
Sylvie G.
Dominic M.
Jeremiah F.
Michael P.
Stan S.
Donald H.
Jerry A.
Michael S.
Stanley K.
Donald S.
Jerry D.
Miguel C.
Stephen E.
Don D.
Jerry G.
Mitch S.
Steve C.
Douglas C.
Jess C.
Mitchell S.
Steve M.
Drew B.
Jess L.
Steve
Morton S.
Steve H.
Drew R.
Jesus G.
Nadine C.
Sid S.
Edgardo G.
Jesus M.
Norm M.
TRW.
Edward A.
Jim C.
Norman V.
Tom B.
Edward B.
Jim O.
Paul A.
Tom C.
Jim G.
Paul R.
Jim M.
Peggy B.
Tom D.
I invite you now to lift up names of people that you have loved that have died from AIDS now. That are not on
Paul
those.
E.
Stephen H.
Howdy B.
Leon C. Lee C. Eduardo C.
Tom C.
Kathleen C.
Bob H.
Scripture says that God writes the words of life on our hearts And I've always wondered why the words are written on our hearts and not in our hearts. And sometimes I think the reason is that our hearts have to break before those words of life really can make their way into our hearts. And everyone here has had a heart broken. So I invite you to invite that those words of life that God has put on your heart and are now in your heart to grow, to resonate, and to be light in everything that you do. It's on you, brother.
And I don't want to let go. Somebody in the comments, Richard N, wanted to make sure that.
Here we go. I'm going to sing Hallelujah by Leonard Cohen. And I think it's very important that I do this. I've been doing it for a couple of years because it gives respect to the people that have been here. They're no longer here. I lost a lot of friends. I was an AIDS buddy, so it was kind of hard to watch people die. I wonder many times why I died. I didn't die with them, but I got to live to do what I do today. Hallelujah. Now I heard there was a secret chord that David played and it pleased the Lord, but you don't really care for music, do ya? Well, it goes like this: the fourth, the fifth, the minor falls, and the major lifts. The baffled king composing hallelujah, 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 hallelujah. Your faith was strong, but you needed proof. You saw her bathing on the roof, her beauty and the moonlight overthrew her. And she tied you to a kitchen chair. She broke your throne and she cut your hair. And from your lips she drew the hallelujah. 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 Well, maybe there's a God above. As for me, I never learned from love is how you suit someone who outdrew you. But it's not a crime when you dare tonight. It's some pilgrim who puts claim to life. No, it's cold and it's a broken hallelujah. 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 Hallelujah.
All right, bravo. All right. I gotta go see a man about a horse. You guys have a happy New Year and a Merry Christmas.
Thank you, man.
Bless
Thank
you all.
you. Thank you, Terrell. Very moving. I was moved by everybody enjoying that with you.
Further back I get, the better I sound.
You sound better when you have help.
That's right. No, that's right. Let the light of this day keep you throughout the rest of this year and through the next year until we come around again. May the light of this group in our hearts, in our minds, in our joy, in our laughter, in our tears, light the way for a better tomorrow while we hold on and cherish the yesterdays that meant so much. Go with that. That was so good.
Thank you, everybody.
Thank you, BJ. Thank you.
Dan, here. Are you still there?
Yes, we're almost done. So come on over here.
Sandy, can you help? On behalf of the HIV
Oh.
Advisory Committee, we want to thank you for
Oh.
live streaming this. It's a small token of our appreciation.
Well, thank you so much. I appreciate it. Thank you. For everybody watching, I'm going to turn around so you can see the tree of names. Hi. So there it is, the tree of names, and that's set up so that anybody who, my camera's off now. There we go. For anybody who wants to like still put a name up, they can put it up, and these names come up every year. We gather here every December 1st. So if you are available next year and you want to come out and be part of the celebration, please do so. There are celebrations all over the country, so you can really join anywhere. As for me, it is an honor and a pleasure to be able to do this for them, for me, for all my fellows who are not around anymore. But it's also a celebration for the people who have made it, for all those who have survived and carry the word and the message. So thank you so much for joining us. It was a pleasure. We will see you next time. I'm Daniel G. Garza, and I'll see you again. Bye-bye.